I wanted to introduce myself. I'm Mary Beth Mason here at Silas Bronson Library, and I wanted to welcome you to the updates on the opioid crisis program, jointly sponsored by Silas Bronson Library and the City of Waterbury Health Department. We are presenting the program as a public service and do not endorse any particular viewpoint. I wanted to let you know that this program is being recorded. All microphones are going to be muted during the presentations, except for the presenters. And if you guys, anybody has a question or comment, I want to remind you, in the bottom of your screen, there's the setting control bar and there's a chat spot, and you could type a question or a comment, and our co-host, Jennifer Dewitt, it will respond to that. And I also wanted to mention, if you do not want your video shown, you can click stop video on the bottom, on the little stop video button. It's kind of on the bottom left. I wanted to, at this time, introduce Jennifer Dewitt, our Substance Abuse Prevention Coordinator for the City of Waterbury, Department of Health.
Thank you so much. Thank you to the Silas Bronson Library and the City of Waterbury and all of the wonderful folks who are here with us this evening. And I see a lot of familiar names and faces on the Zoom, so thank you for being with us. The Silas Bronson Library, back, goodness, I want to say late winter, asked if we would host an event on the opioid crisis, and we thought with our Warm Handoff to Care starting and our Overdose Data to Action Grant and our opioid outreach workers being hired, that we might host a forum to introduce everyone. And then the coronavirus hit, unfortunately, and all plans got postponed. But here we are, and I'm really, really grateful and excited to see all of you, if not in person, virtually, so that we can still introduce you to the wonderful team that we have here in our city doing really important work. So thank you so much for being here. I have a PowerPoint to share and just start us off to give you a little bit of background and information about what we're going to discuss tonight and state and local level data, and then we will introduce you to our team. Each member will share for about 5 minutes with you what it is that they do in the community, their role, and we would love for you to ask us your questions. That's what I really wanted. I did not want there to be a forum or an event where people get talked at. I wanted there to be an opportunity for you to tell us what your questions are and how you, as community members and community partners, can work and help to address the opioid crisis that we're experiencing. So thank you all for being here, and I am going to do my best to share our PowerPoint presentation with you now. Let's see how good I am at this. Whew, success. Okay, so let's see, and I see there's a waiting room going on. So this is responding to the opioid crisis, a unified public safety approach. And as Mary Beth said, I'm Jennifer Dewitt. I'm the Prevention Coordinator for the City of Waterbury Department of Public Health. I am coming upon my 1-year anniversary of being able to do this wonderful work. I was hired by the mayor's office to coordinate efforts to address the opioid crisis. And we are proud to report that we are funded by 2 grants, a state and a federal grant. The state funding is from Connecticut Department of Public Health, and it is called Overdose Data to Action, or OD2A. And there are a number of strategies that we are engaged in under that funding, which is about 2.7 years worth of funding. And we are also federally funded by the Kukli grant, Combating Opioid Overdose with Community Level Interventions, which is out of the University of Baltimore. And a great piece of that grant is to do research and to actually evaluate our initiative, one piece of our initiative that we're going to talk about tonight, which is the Warm Handoff to Care, which is happening here in the city. So those are our 2 wonderful funders right now, both federal and state funding. It's close to $1 million worth of funding, and that's something that the city of Waterbury is really, really proud of. The federal grant alone, we were one of only 11 grantees that were awarded this funding across the nation. So we're really proud to have that funding and looking forward to applying for another year. So let's see if I can advance my slides here. There we go. So tonight's agenda, a lot of folks ask, how has the opioid crisis been impacted by COVID? And the answer to that is it has, and in a number of ways. So we're going to start off just by sharing a little bit about that under the shadow of the pandemic, how substance use is affected. As I said before, we're going to share a little bit of our current local and state level data. We're going to spend just a few minutes talking about the continuum of care because prevention happens across the lifespan and in multiple ways. And we know that when we are talking about the opioid crisis, there is not one answer, one solution, or one magic bullet that is going to cure our nation of this this condition. So we have to engage in multiple strategies, and that's what we'd like to introduce you to, is what those strategies are. Then we're going to introduce you to our team. We're going to give you 10 quick ways that you can be part of the solution. So anybody, you don't have to be a clinician, you don't have to be a person in recovery, you don't have to be a first responder. Everybody can be part of the solution, because a lot of times we're really good at talking about the problem and not the solution. We want you to know how to be part of it, and then we want to make sure that we answer your questions. So when we talk about the impact of the coronavirus on substance use disorders, what we see is that there has been increased isolation when the pandemic first began and all but essential services shut down for people who were engaged in outpatient and intensive outpatient and self-help recovery supports, peer support such as Alcoholics Anonymous or Narcotics Anonymous. Suddenly people couldn't leave their home and were told to stay home and told to not go to work. And so their routines were disrupted. Their natural opportunities for engagement were disrupted. Their natural opportunities for connection were disrupted. I think it's John Hamilton was the first person who I heard say this, that the opposite of addiction is connection. And that is very, very true. People who struggle with substance use disorders feel isolated and alone. And so connection is the opposite of that. And when we reduce opportunities for connection, we increase risk for persons who have a substance use disorder. In addition, whether you have a substance use disorder or not, as a result of the pandemic, many Americans are facing increased levels of stress, financial distress, future distress, worrying about health impacts, economic impacts, educational impacts for their children, family disruption, all sorts of change that it can be significant for some folks and create a tremendous amount of anxiety and turmoil. And so, again, for people who are experiencing elevated levels of stress, elevated levels of distress or anxiety and or depression and or other conditions, and then decreased access to behavioral health care, that was a real speed bump that we experienced in the beginning of the pandemic. And for people who struggle with substance use disorders, they oftentimes tend to have compromised health and immune systems. And so for people in particular with a substance use disorder, they may be particularly vulnerable to becoming ill and or dying or losing someone as a result of COVID-19. And I know because when this pandemic first started, I had to switch hats and gears because people weren't worried about the opioid crisis. So I took off my opioid response hat and I put on my social services basic needs response hat for the city and was responding to COVID positive and quarantined families who needed help and support to stay home and stay safe. And we had a number of families throughout the course of the early months of the pandemic that were struggling with a substance use disorder and getting methadone or Suboxone, one of the medication-assisted treatments that they had, and or their comorbid other mental health conditions, or having lost a loved one who was also struggling. And so we saw some of our most vulnerable people become most affected as a result of this crisis. And we also saw healthy people who were staying home and not going to work engaging in unhealthy coping strategies. So one of the things that we've seen early on is, increased levels of substance use, both legal and illicit. So increased alcohol use as well as other kinds of drug use, and increased incidence of domestic violence. We've seen a lot of those changes happen just in the earliest months of this crisis. So that's just some background on how the coronavirus has impacted the opioid crisis. It has not helped it. In fact, in some ways it has made it worse for folks and for our nation. This graph is our state level data as of yesterday. So as of yesterday, we have unfortunately lost 830 people in the state of Connecticut to an overdose and an unintentional death. We still see 3 out of 4 fatal overdose victims are male. We still see New Haven and Hartford counties as the hardest hit counties in our state. And we still see white non-Hispanic males as our most heavily affected population experiencing death as a result of an overdose. And we still see the #1 location where fatal overdoses occur are in a residence. So just a little state background information and data for you. And comparing overdoses from this time last year. So year to date, so from July of 2019 to July of 2020, we saw a 20% increase in the number of drug overdose deaths. And we are continuing to see increased presence of xylazine, which is an animal tranquilizer, an animal sedative, and fentanyl being a toxic cocktail, if you will, in fatal overdoses. Xylazine first started appearing in fentanyl, and fentanyl's an opioid, fentanyl-related overdoses in 2019, and it has continued to appear as a lethal combination in our overdoses this year. And the presence of fentanyl in fatal overdoses has continued to increase. It was a little over 80% in 2019, so 80% of all fatal overdoses involve fentanyl. And to date, our data in 2020 as of August, 85.5% of fatal overdoses have fentanyl present. And your bar graph that you have there is just our 2019 to 2020 fatal overdose data month by month here in the state of Connecticut. And you will see that for all months available up through July, we have higher numbers of overdose fatalities in 2020 than we do in 2019. Slightly different when we look at our local landscape, which we will in a moment. But you can see, right from the beginning of the year through present month, and especially during the immediate shutdown. So March and April, you see enormous differences in the fatal overdoses here in Connecticut. So this slide is just a screenshot. And I know it's a little bit hard to read. I don't want you to spend a lot of time on it. What I do want you to see is this. This is a screenshot of the Office of the Chief Medical Examiner's fatal overdose data for all deaths in Connecticut. And I sorted this just through Waterbury. So this is just a screenshot of just a couple of Waterbury fatal overdoses. And what you will see here is that when someone dies of an opioid-related overdose here in our city, it is not ever just heroin or just fentanyl or just opioids. You are always going to see a toxic cocktail of substances in a person's system. So if we, look at the lists of substances, or even just the pull down of substances, you're going to see heroin, you're going to see fentanyl, you're going to see ethanol, which is alcohol, you're going to see maybe methadone, maybe some amphetamines, maybe benzodiazepines, which are medications such as Xanax or Valium. You're going to see xylazine and other kinds of substances. And so I share this to just kind of highlight for folks that it's not just the opioid crisis, it's the drug crisis. And it's not just drugs, it's alcohol as well. And when you couple, a sedative such as alcohol on top of a sedative such as an opioid on top of a sedative such as a benzodiazepine, that will really quickly stop a person's breathing and take their life. And so we have to understand the importance of naloxone as one of our medications to reverse overdose, but also the importance of calling 911 and getting a person immediate medical attention, because naloxone only works on opioids, and that is not the only substance that is in a person's system when they're experiencing an overdose that results in a loss of life. So locally, we have two things happening here in the city of Waterbury. One of the things that's happening is that fatal overdoses have gone down. And I would like to say that that is due to a robust distribution effort by the city of Waterbury and Waterbury Health Department's opioid outreach workers and other partners across the city, as well as the Regional Behavioral Health Action Organization. There have been so many partners that have been working to educate folks about the importance of distributing naloxone, identifying an overdose, using the app, the NORA, Naloxone Overdose Response app, and saving lives. So a tremendous amount of education and awareness raising and distribution has happened to make naloxone available to reverse an overdose, keep it from being fatal. So it looks like we're doing a great job with that. Not as many people are dying as a result of overdose. However, overall, overdoses are way up for the city of Waterbury. So our first bullet point is our year-to-date non-fatal overdoses. So as of September 2020, as of just this week, we have had 408 non-fatal overdoses here in the city of Waterbury, 408. Last year at this same time, we had 310. So we're up by about 100 overdoses, non-fatal. We're down for fatal. So last year at this time, there were 79 fatal overdoses. Right now, we're looking at a possible 73. We have some autopsies pending. We have, I believe, about 55 confirmed fatal overdoses in the city of Waterbury right now. So it looks like fatals are down, and that's good, because as long as you are alive, you have an opportunity for treatment and recovery and support. Someone is unmuted. Wherever you are, make sure you mute yourself. Thank you. For the total of last year in the city of Waterbury, 424 non-fatal overdoses. So we're already really close to that. We are definitely going to surpass that for this year. And 109 fatal overdoses total. And we are much down from that. Mind you, we still have, 3 months to go for the rest of this year. But we are down. In total Narcan deployments by Waterbury Police Department, 689 Narcan deployments. So 689 times Waterbury law enforcement have deployed the use of Narcan to save someone's life and to reverse an overdose. So we thank them for that life-saving effort. And that's an important piece of tonight also. It's not highlighted enough that the response to the opioid crisis has to be a public health and public safety partnership. A partnership, really, a relationship, a solid relationship. We have to work together. Prevention cannot do this alone. We've heard every police chief in the universe say you can't arrest your way out of substance use disorders or the opioid crisis. We all know this, but there is still an opportunity for enforcement to help, and enforcement plays a very important role in public safety. So we got to remember that the opioid crisis does not get solved just by health, just by prevention, just by treatment. We need everybody at the table. We need all hands on deck, and we're very grateful to have that support tonight and here in the city of Waterbury. So when we talk about the spectrum, primarily what we do here with our efforts, the city's efforts, is we rely heavily on prevention and intervention supports and strategies. Treatment is a piece of that, recovery is a piece of that, but those services are provided by our treatment providers and our recovery support partners. So when we talk about prevention, we talk about things like primary education and prevention across the lifespan, and starting with the littlest kiddos in school We also talk about community education and awareness raising, because everybody needs to be educated about this topic. We talk about community-based processes. So I coordinate a greater Waterbury area opioid abuse prevention work group. Everyone is invited to the table. We have treatment providers, first responders, people in recovery, people with lived experience, loved ones, health districts, youth service bureaus, school personnel. Basically, if you have an impact on or you're impacted by the opioid crisis, you are welcome at our table. And our job is to network, share information, provide education, and collaborate, tighten and strengthen the safety net so that no one falls through it. And advocacy and policy development is another important piece of what we do. So making sure that our policies are accurate and effective, our strategies are properly funded, and you know, again, we've got the right people at the right places at the right time, saying what needs to be said. We have a wonderful staff member who's going to talk to you in a little while, and she says, I think she says, I'm probably going to mess it up, Roshni. She says she's a recovery broker. That's what she calls herself. That's an advocate, and we need more of her every day. Early intervention strategies, harm reduction. Our opioid outreach workers are going to give you a great education about what they do in the community to connect with people at risk and to provide harm reduction supports. There's a lot of different things that are harm reduction. Some people think of harm reduction just as syringe services. Some people think of it as, safe use kits. Some people are grossly against harm reduction. And then some people will say, oh, but I carry Narcan. That's harm reduction. So you're going to learn a lot about harm reduction tonight if you don't already know about it. And we are happy to tell you more. And again, teach you how you can be part of the solution. Education. So when our opioid outreach workers are outreaching and when our overdose response techs are connecting with overdose survivors, part of their job is to provide education. And that education is something like, hey, when you get out of detox, you are going to be really at risk of experiencing an overdose. We want you to know how much more at risk you are when you get out of treatment compared to where you're at right now, because people don't realize that. And when we are seeing repeat overdoses, or unfortunately overdoses that result in a fatality, it's when a person has had a recent period of abstinence from drug use, which is when everyone thinks they're doing great, right? But then they have a slip and it results in a life lost. And so we want people to know what puts you at risk. Recent period of abstinence puts you at risk. Do not be unaware. Screening. Our opioid outreach workers work closely with our HIV and STI outreach workers to make sure that people are screened for appropriate care and services. So if they have a sexually transmitted infection, if they have another kind of communicable illness or disease, we want them to get screened and get care so that they can stay safer, they can stay healthier, and they can keep other people from getting sick as well. And access to those services is key. So, you know, when we talk about treatment, we see the right door at the right time on the right day over and over and over again. That goes for other kinds of early interventions as well. Access is key. And we sometimes say that the opportunity is like an elevator door opening. And if you do not step in and put your foot in, that door is going to close and that access is no longer going to be there. And we want to reduce and prevent that from happening. We want everyone to get their foot in the door, in the elevator, push the button, and get to the floor they need to get to. And recovery supports, the last piece of the spectrum and the ongoing piece of the spectrum. One of our staff tonight is going to talk about the thing that I like to remind him of often, which is that he is living proof that recovery is possible every single day. The people that I have the privilege of working with who are themselves in recovery, they are the beacons of light and hope for people who are out there and struggling and don't see themselves being able to walk in those shoes. And for those of us who support and care about and love someone who is struggling, I want to remind you that as exhausting as it can be sometimes, and I know that firsthand, don't give up hope, because as long as a person is still breathing, they can recover, and that hope is so, so, so important. So with that said, let's see. I'm not going to introduce our folks just yet. I just want to share this one example, but then they're going to talk more about it. So Our Overdose Data to Action grants opioid outreach workers, Vinnie and Edwin. You're going to meet them in just a minute. They were hired during COVID shutdown. And their supervisor and I weren't sure if we could pull it off, but we pulled it off. We developed an orient from home schedule, and we oriented them from home. And then we had them come into the health department. Things were still shut down, but we got them ready. And then they were so darn ready, they couldn't be any more ready. And then we let them go out into the community. And they went out day after day after day, surveilling and gathering information and watching different neighborhoods and different areas of our city, and identifying the places that they needed to be at in order to do their outreach. And so over the past 3 months, they have been outreaching the heck out of the city of Waterbury and connecting to people at risk and offering them all sorts of goodies and items, giveaway items, things that people at risk need, like body wipes and masks and hand sanitizer and chapstick. And it might sound like the littlest thing, but it's a tool to engage a person and say, hey, come here, let me talk to you for a minute. No, I want to give you something, but I want to have a conversation with you. And then they talk to them and they explain what it is that they do. And before you know it, the person walks away with, 285 naloxone kits or 693 fentanyl testing strips, which are both phenomenal harm reduction tools. And so when our opioid outreach workers are out and doing their job, number one, they are engaging people and building trust and relationships. They're letting our most at-risk population that a lot of people ignore when they walk by on the sidewalk know, I see you, I care, and your life matters to me. When they distribute naloxone and provide education about this medication, they are teaching a person at risk to engage in self-care. So maybe they are not ready for treatment and recovery, but their life is valuable. And most people, who are at risk have ambivalence. There's a part of them that knows that their life is important, and there's a part of them that doesn't care right now. And we have to recognize that, and we have to grab onto the part of them that understands that their life is important and remind them of that and give them the tools to stay alive. Fentanyl education and testing strips, same premise. Without judgment, we have to recognize that a person who is using drugs is going to use drugs until they are ready to stop using drugs. And if we do not teach them how to use drugs safely or in a way that reduces risk, they are going to die, and then there will be zero chances for them to get help and to recover. So fentanyl education and testing strips creates that opportunity again and reminds a person that we are here, we care about you, and when you're ready for help, you can come see us. So I now have the privilege of introducing you to our team. I just want to look at my time. Okay, perfect. It's exactly where I want to be. So from prevention to treatment and recovery support, not all of our folks are able to be here with us tonight. Krista Martell, who is not able to be with us, she was our, and still is, our, she was a prevention core service member, but now she is overseeing some of our COVID-19 work and basic needs response. But she's in charge of coordinating our opioid work group. So she helps get out the meeting reminders. She sets up the Zoom meetings for me because I can't do the work of 4 people. So Christy's one of the 4 people that does that work. When the pandemic hit and everything shut down, Christy was like, I'm going to figure out how to do Narcan training online, and then we're going to do it online, and then we're going to do curbside pickup. So there was not even a hiccup in our Narcan training during shutdown. People who still needed education were able to get it, and people who needed safe availability of Narcan were able to get it as well. So Krista Martell was really integral in helping to make that happen, and she is one of our real backbone staff, and we're grateful for her efforts. Carly Matasavage is able to be with us though, and I'm going to introduce her in a minute. She was a Western Connecticut State University intern with us this spring. She has done a phenomenal job of providing marketing materials and educational information. And we have a series of public service announcements that are going to be coming out in the next few months that she worked very closely with the city's videographer on. And the campaign is called Come See Me. And it pairs some of our key and very well-known and recognizable city leaders with a message and a piece of data and information about substance use disorders, about stigma, and about the opioid crisis, and ends with the tagline, I am so-and-so, and you can come see me. And so I can't wait for that to be ready to launch. We'll let you know when it is. Vinnie Valdez and Edwin Leon, I will share their bios with you shortly. They are part of our opioid outreach team. They are our first two employees hired with our Overdose Data to Action grant, and they are the ones that we started and launched during the shutdown period of the coronavirus. They are supervised by myself and Samuel Bowens, who has been a long-standing director of HIV and STI programming here at the health department. He is my partner in crime when it comes to outreach. He's been doing this job a long time, and I could not support Vinnie and Edwin without him. So Sam is going to, I think, join us. He said sometime between 6:45 and 7, so we put him a little later in the agenda. And is he on, Edwin? All right, he's on, good. And then after him, Rushni and Cam are opioid outreach workers, and their lieutenant, my other partner in crime, but not really in crime, Lieutenant Michael Stokes from Waterbury Police Department. So I'm going to share Carly's bio with you and introduce her, and then let her tell you for a few minutes about what it is that she does. So Carly is a recent college graduate from the Western Connecticut State University. She has her Bachelor's of Science in Health Promotion Studies. Her main focus was on community health. She recently concluded her internship with us in the prevention unit and currently works addressing COVID-19 as a manager of basic needs and contact tracing. In her time directly working with the prevention unit, she helped to develop our public service announcement called Come See Me. And she can be found as the person behind a billboard that we had on the top deck of the Mixmaster right here in Waterbury. Bus shelter advertisements about Waterbury's warm handoff are available, and the first slide that we showed you this evening of our PowerPoint has that advertisement. She has developed really cool business cards, of which I don't have one right in front of me, but I should. But they are front and back sided cards that have our tagline, Come See Me, and they flip open and have all of the resources that we want folks to know about. So again, even if we're not able to have more than a single conversation with persons, all of our opioid outreach workers and our overdose response technicians are able to hand over this card that's not just my name and number. It's our DEMIS access line for substance abuse treatment services. It's the Nora Saves app and information about how to download that resource. And it is the DEMIS Addiction Services website that shows you real-time bed availability. So even if we never see a person past that one interaction, when we give them this card, we give them 3 important resources that can save their life and then can help make a connection to care for that person. And Carly Matasavage is responsible for that. So I won't tell you anything else about her. I'll let her tell you the rest. I'm going to do my very best to shift gears and let her take the screen and talk with you for 5 minutes about what it is that she does.
All right. Hi, everybody. So Jen covered a lot of what I do, but I have worked on a lot of different projects. I am kind of the ordering queen around there. I've made a lot of personalized giveaways like stress balls, lip balms, water bottles, bags. Honestly, if you name it, I probably have made it or ordered it at least. Our social media on Wednesdays, I kind of took that one over too. So if it had Narcan, QPR, opioid facts, awareness months, days, weeks, I probably posted it. And that was a lot of what I did. And like the billboard, the bus shelters. I designed all of those advertisements, worked with Chrissy to find companies willing to post them, posted them, and I worked closely, became best friends with our accountant, and made sure that we got all of that posted. But the ultimate culmination of my internship was production of the original PSA called Come See Me. The production, as Jen stated, used well-known city leaders and stigma-busting facts about substance use disorders, and it invited the viewer to learn more from these leaders and others from the city. The key message highlighted that no matter who you are and no matter what you look like, you can come see me for help and for more information. And more importantly, it showed the faces that would actually be there in the city of Waterbury to offer help and offer the warm handoff to care. Everyone would be found in the city. No one was found off the street or paid to be there. Everyone was there just because they really wanted to be. And I thought that was really special and powerful and well needed in the city. And this was probably my first time doing anything like this, but as someone who recently graduated college, I couldn't have been more fortunate to work with such a wonderful team and so kind and helpful and educating. I was very fortunate. I don't have too much else to say besides that, but.
Thank you so much, Carly. So let's see. So Maria Coutat-Skinner, who is a good friend, and she is the CEO of McCall Foundation in Torrington, said that she's so sorry that she had to run and attend another function. But two of her staff are here in the room with us, and she just wanted to say that we're doing such a great job, and she really looks forward to speaking with us soon. So thanks to Maria Skinner. And McCall Foundation and Help Incorporated are actually going through a merger at this time and are in the process of becoming one really awesome organization together. They are both fantastic treatment providers in the area, so we're really grateful to have their partnership and collaboration, and they serve on our opioid work group as well. And Maria coordinates the Litchfield County Opioid Task Force, where, you know, everybody steals from everybody. That's the really cool thing about opioid work groups and opioid task forces is like, there's no like, oh, that was our idea. It's like, oh my God, that's the best idea. Can we do that too? And so that's a really wonderful thing about all of our different work groups and task forces. Is we're able to share and spread. And Connecticut, we're really fortunate. It's such a small state that it's really easy to cover all of the ground there is here and to make it a collaborative effort. So we're grateful for her. All right, so next I would like to introduce to you Vinnie Valdez. He is our young newbie as an opioid outreach worker. Just to give a little background and tell you a little bit about him. I want him to talk about what he does, what's in his backpack, what's cool about him. And like I said, the PowerPoint presentation is going to be shared out with you. There are two photos on our spectrum of care, our prevention, intervention, treatment, and recovery page. And those are just some of the things that Vinnie and Edwin carry around when they're doing outreach in the community. When Sam and I were considering hiring Vinnie, one of the things Sam said is, man, he's brand new to this and to this area and to the field. And I said, that's a good thing because he is young and he is moldable and he can probably be one of the best opioid outreach workers in the universe if we just give him the support he needs to be that. And so far, we have not been disappointed. Vinnie is an absolute rock star and we love him. And I'm happy to introduce you to him. So Vinnie, tell everyone a little bit about what it is.
Okay. Hello, everyone. My name is Vinnie Valdez, and I'm an OD2A prevention unit outreach worker. My role with the city of Waterbury is just to go out into the community and educate and, talk to people, and, about the dangers of, opioids and, fentanyl. And so what we do is we talk to them about, all the things.
You're muted, Vinnie.
Vinnie, you got muted for a second.
Myself. There you go. Can you hear me now?
Yes, got you now.
Okay. All right. So my name is Vinnie Valdez, and I'm a OD2A prevention unit outreach worker with the city of Waterbury. And my role with the community is just to go out and educate and distribute Narcan and naloxone and fentanyl testing strips to people who are that use opioids. Not only people who use, but also their family members and friends who want to help. Their either their significant other or their family or friend out that do use. When we go out, we carry a lot of our equipment in our book bags. So we carry Narcan kits, harm reduction kits, which include burners, little cotton balls, burners, hand sanitizers, bottles of water, snacks. I know a lot of these these people, they're hungry. They're out there just searching all day. And there was one time we were out and I heard this little girl say that she was really thirsty and hungry. And I looked around and I was like, man, I was like, Sam, we have to order some water and maybe some snacks, and we could put together like a kit where we could just hand out and start, and that'll be like a kind of like a icebreaker. It'd be easy to talk to people, handing stuff out like that. We also carry hygiene kits with us, with combs, soaps, shampoo, and not only do we want to prevent unsafe opioid use, we also want to prevent the spread of diseases. So we also carry around safe sex materials to give out to certain individuals who are high risk for spreading diseases. So not only do we do that, we also carry around our business cards for our HIV prevention unit in case they wanted to get tested for STDs or HIV. We could also do that as well. When we go out, we just try to pinpoint hot spots, and we just try to take as many pictures as we can of the area. When we're out there, we see a lot of syringes on the ground, so we try to avoid that area. We have stick-proof gloves that we do carry with us. We see any type of syringes on the ground, we pick them up carefully. We have a sharps containers kit with us. We just make sure we dispose of that properly. In the pictures that Jen posted up earlier on the slideshow, it had a picture of some of the items that we do carry in our book bags. So we have business cards, we have pamphlets, we have our sharps container, we have water, we have chips, fentanyl testing strips, Narcan. We usually give out thermometers, especially with the opioid crisis going on. Everyone wants to try to take their temperature, so we just try to keep everybody, as safe as we can, especially nowadays. And that's it. I just want to help the community out as best as I can. I'm from Waterbury, and I just feel like it's like my duty to help out as best as I can.
Thank you so much.
You're welcome.
Don't forget, folks, if you do have questions, you can put them in the chat box. You can put them in the chat box throughout the presentation. We may hold them off to the end, or we may have folks answer them, right away. But please, don't be afraid to include your questions now. We don't want you to forget about them or not have an opportunity to ask one of our team an important question, especially if you are not able to stay with us the full time. So feel free to ask them. So thank you so much, Vinnie. Our next opioid outreach worker that we will introduce is Edwin Leon. Edwin has his bachelor's in psychology, and he comes to us with a 15-year history of working at the St. Vincent de Paul Homeless Shelter as a case manager and a lead case manager. In 2014, Edwin began working for the HIV prevention program here in Waterbury through the health department, and later joined us again as an Overdose Data to Action, or OD2A outreach worker. And now he does opioid abuse prevention, and he is bilingual, and we love that about him. He is able to connect in a special way with our Spanish-speaking population. And as part of the PSA that Carly worked on. Edwin has our Spanish-speaking message and also has Spanish information about the Nora app and instructs people how to use the Nora app in Spanish. So his job includes all the awesome things that Vinnie talked about and more. I'm going to let him tell you a little bit about what it is that he does and what a day in the life of his role looks like. And I asked him to share some challenges or successes or takeaways, things that he wants you to know about. So Edwin, take it away.
Hello, hi. My name is Edwin Leon again. I'm an Overdose Data to Action outreach worker. Vinnie tapped into a lot of things that I do as well, Narcan distribution and overdose prevention to our focus population, those actively using opioids and their families. We also go out and find their gatekeepers and allies that can help us with that. We also distribute Narcan to businesses like barbershops and bodegas and hotels who are interested in the Waterbury area. Like he said, we also work with the Syringe Service Program, Apex. We give out their flyers, they give out our flyers, so we help each other. We also work closely with our prevention team. We also give out safe sex materials because like Jennifer said before, it's just not the opioids, it's other drugs and probably unsafe sex that they're having and other stuff. So we try to cover all those bases. We also attend community events for education and distribution. We all have a divider in our table, make sure that we keep 6 feet away and maintain distance, but it's not always possible when you're in the street with a lot of people. They now that they know us and they're getting to know us, they come right to us. Hey, you have water, you have this, you have that. So it's very hard. So that's one of the challenges, but we try to elbow and tell them, you know, to maintain their distances. What else? We also came up with the intake form too, to actually capture all the data, because it's really, I have a little copy here, but it's, I don't know if you can see, but it's really involved. I mean, the EC2prevention.org wants to know everything from ethnicity to race, employment, to sex at birth. Have they been vaccinated for hepatitis A, B, or C? Have they been tested? What were the results? What is the drug of choice? What's the second drug of choice? When did they first inject? All those questions we have to ask while we're out there, and that could get very difficult. Some people are very receptive, others are standoffish, but for the most part, Vinnie and I and Sam have it down packed. We don't attack people. We don't all go together and act like we're like cops. No, we're just one at a time. We go up to them, and if they warm up to us, then we could assist with them. What else? We also keep a log. We have community Narcan lots, and we have focus population lots, and we're doing very well with that, with distribution. What else? For me, it's personal. I would like to say that I've lost family to opioids, so I really take it personal. So I like to be out there, and one of the most, besides everything we do, is bring hope. That, I think, is the most important, that they know that we out there and that we care for them and that we're there for them. And whenever they're ready, like you said, it's not a magic bullet, but when they're ready, they could come see us. Thank you.
Thank you very, very much, Emma. So let's see. Melissa had asked for Vinnie and Edwin's email address. So we put that in the chat, and our CEO of MCCA also shared their information about services here in Waterbury, and we do use them, John. Our overdose response techs have a list of all of our local level treatment providers, and especially those who provide DTACs or MAT services or have open access hours. We include those in their list, highlighted in different ways. So again, like they know quickly how to connect someone to care when that door opens and the person is ready for care, so we can get them in right away. And Scott Nelson and everybody else at MCCA have always been wonderful and consistent participants in our opioid work group as well. So thank you. And then let's see. I think Cam's dad is on here and said we pulled together an awesome team. Yeah, I'm pretty proud of this team. And the library says, I don't know the name of it. I heard there is a new improved methadone type of treatment I heard about. Will Waterbury soon have access to that? I do not know about a new and improved methadone type of treatment, but there are multiple medication-assisted treatments. Methadone and Suboxone are opioid replacement therapies, and Vivitrol is an opioid blocker. And those are the forms of MAT that I am aware of right now, but I don't know everything there is to know about everything. And let's see, Paul Gandowski, Connecticut Counseling, also in Waterbury. Yes, we have all the Connecticut Counseling Centers locations and information as well. And so I'm going to make a note to myself right now to share that list. It's not an all-inclusive list. It's the list that our overdose response technicians use. But again, for anybody looking for treatment resources and you know, maybe you're just looking specifically for Waterbury, we're always happy to share. And Cam and Rashni have called and made sure the numbers work and the hours are accurate. And so I think we've got a pretty current list of treatment resources. So with that said, I want to just check because I haven't seen his name show up. Is Sam Bowens, is Sam on here? If he is, Sam, would you unmute yourself? I don't see him anywhere. Well, if Sam's not on here, if he joins us later, we'll let him sneak in. So so I'm gonna move on to Rashni. I hope she's ready. Rashni Vereen is one of our two, there she is, opioid response technicians. She works for the Waterbury Health Department. She is certified as a recovery coaching professional through CCAR, Connecticut Community for Addiction Recovery. She previously worked as a recovery coach for MCCI, the Midwestern Coalition Council of Alcoholism. She also worked as a DCF social worker for Department of Children and Families for over 18 years. She spent 12 years as a caseload worker and the remaining 8 years as a care line call taker. Her future goals include attaining her recovery support specialist certification through Advocacy Unlimited. She is also very passionate about advocacy and education. As I said, she calls herself a recovery broker, and I love that title. And she feels a very strong responsibility to serve her community well, and she does that. We returned to the office this afternoon just from a meeting called Project Safe Neighborhood, where we meet with all returning citizens to the Waterbury area, all people coming back into the community who are on parole and probation. It's part of a U.S. Department of Justice initiative where they are greeted by the chief of police as well as state's attorneys, and then there are treatment providers, social service providers, education and employment providers who all meet with returning citizens to say, hey, we want you to be successful, we want you to be healthy, we want you to have a good return and not to recidivate. And we will also have zero tolerance for continued criminal activity in our city. It's our job to keep our city safe. And then each one of the providers has a chance to talk with the people there. Today we had 38 men there, and Rashni got up in front of them and just did her thing and told them who she was and where she came from and why she cares about their life and their recovery. And there were head nods, and there were you know, acknowledgments and recognition, and people talked to her afterwards and took her cards and wanted to learn more. And we actually had an individual who went through some kind of not recovery coaching, but like addiction counseling training while he was incarcerated, and was interested in learning more about our program and how to volunteer. And so we referred him to CCAR for recovery coaching training. So I'll let you, Rushni, tell you more about herself, what her job and role is. Rushni, take it away. Hold on, you're muted. You're
Good evening, everyone. I'm not sure there's much more to add after that, but it's a pleasure to be here with you this evening. And so she filled you in on a lot of my background. But yes, I am a recovery coach and now an overdose response technician. So part of the responsibility of being an overdose response technician is the overall goal is to connect individuals to care. What we do is we get dispatched to the scene of an overdose with the Waterbury Police Department, the Waterbury Fire Department, as well as EMTs. If the individual has been brought back with Narcan, sometimes it's used, other times it's not used, and we're able to have a conversation, we will. A lot of times we do end up following up at the hospital, and even then the individual is not coherent because of the impacts of the substance that they used, or could also be the Narcan as well. So a lot of times we are able to just gather some information and leave them with cards, and then we're able to have a follow-up conversation within those following days. We also respond to community calls. So sometimes we'll get called out, by the Waterbury Police to maybe speak with someone that's homeless, someone that may be battling substance use disorder. That's an opportunity to educate them and give them harm reduction supplies. A lot of times people have already been through treatment and they're just not at that stage where they want to, but we will offer harm reduction. So we carry in our backpacks Narcan. We're also trained to utilize Narcan, and I am going to show you some of what we have. My partner in crime here will pull out some of that stuff for you. Here it is. This is the spray that can be inserted up the nose, and pretty much it's the opioid blocker to bring the person back, because a lot of times they're blue, they're not breathing. In addition to that, we have the NORA card, which gives you all the signs of an overdose. It tells you how to use the Narcan, and you can also download the app. We will also give out resources, which this is all the syringe services programs. I want to say this one may be about in Connecticut. So we like to give out resources, but also for those who may have a loved one and they just don't understand the impacts of opioids and things like that. If they want to attend support groups or meetings, we have NAMI. Now, this is a refrigerator magnet, but it tells you where you can go. You can attend virtually and you can be anonymous. A lot of people just don't understand. So in situations where I'm not able to speak with the individual, I will try to reach out to the family and see if they're interested. And it is a good thing, because a lot of times families will say, you know what? Yes, I will take the Narcan. And we even had a situation recently where I was able to provide a parent with the Narcan, and she was able to use it at a later date on her own child who overdosed. So we push harm reduction. Part of harm reduction, I know Jennifer explained a lot of it earlier, but I always stress, let's keep you and your community safe. How can we do that? Well, let's use clean needles. Don't share needles with each other. You can get all types of infections and things like that. So we also talk about proper disposal. We wouldn't want a child, a parent, or someone walking down the street innocently and getting poked by a needle. So we talk about proper disposal. If a person doesn't have one of these, which you can buy inexpensively, I think at like a Walmart or somewhere, then you can use like a coffee can, maybe like an empty detergent bottle, but just label it to dispose properly. And I have seen people in the community that have their own ways of disposing. Even I've seen old cookie can canisters. What do you call them? Canisters. So I've seen people dispose of it that way, but it's important to keep yourself and your community safe. It was mentioned, or I'm not sure if it was mentioned earlier or not, but I am in recovery myself. My thing was Percocets, opioids, and then I began experimenting with benzodiazepines and alcohol. So one of the things that I tell people, as I've been in recovery for the last 3 years, that it is my responsibility to pay it forward and to try to pull someone else out on the other side of this, because not everyone makes it. We've heard of lots of opioid related deaths. So, you know, anything that I can do to help someone else, it is actually an honor for me and a privilege to be able to not only share my story with others, but just to serve my community. So I just wanted to show you the Come See Me cards that we pass out, which has our names.
Thank you, Carly.
Yes, Carly is awesome. Awesome. We love her. The Demas Access line is in there, the Nora app, Connecticut Addiction Services. So a person could literally say, listen, today's the day, I'm ready. They can pick up that phone. And the other great thing is that they can call Access Line instead of transportation. As long as it's detox, they will pick that individual up from their home address and get them to detox. As a matter of fact, someone I met in the community less than, I want to say 2-3 weeks ago, he went into detox today. I'm very, very proud of him. So we don't always get the person on the first day, the first try. There's times where I've been calling for 2-3 weeks trying to get in a person, but they will end up picking up the phone and agree to meet me in the community or sit down to have a cup of coffee. And we open up that conversation, and the fact that I can relate. I understand what going through withdrawals are. I understand how this impacts the body. So that does help out as well. So that's my little spiel for the evening. Thank you for allowing me to present. And I'll pass it over to my partner, Cameron.
Thank you so much, Russ.
Or Jen. I think Jen has to.
Jen, do you need to speak first?
I do. I got to introduce you. So Cameron Green is our other. So Rushni is known over Northwest Dispatch as ORT1, and because ladies before gentlemen, and Cameron is ORT2. So when Northwest Dispatch places a call for a possible 49 OD, 49 is a medical and an OD is an overdose, they're asking for either ORT, ORT1, ORT2, and Cam and Rush use their police radios to communicate with Northwest and to find out more information, and then, as they said, to respond to those overdose calls. So Cam is a recovery coach trained by CCAR. He and I and Lieutenant Stokes are just a few hours away from having all of our training hours in to apply and sit for the recovery coaching professional designation. He is currently interning as a drug and alcohol counselor at Waterbury Hospital's Outpatient Addiction Services Unit, and he's in my alma mater, Naugatuck Valley Community College, in the DARC program. DARC stands for Drug and Alcohol Recovery Counseling, and he's also trained to train other people to use naloxone. And so along with Rushni and Edwin and Vinnie, whoever they interact with in the community, whether it's a person at risk or a loved one of a person at risk, or even just a good Samaritan, they're able to train that person to identify an overdose, to use naloxone, to respond effectively, and then to give a naloxone kit to that person to potentially save someone's life. Cam is also certified in wilderness first aid through the National Outdoor Leadership School. His hometown is Cheshire, Connecticut, where he graduated from Cheshire High School. Cam is also a person in long-term recovery and is passionate about helping others in whatever pathway of recovery they choose. Like myself, he believes that there are many doors to recovery. His personal and professional goals include becoming a certified addictions counselor and eventually a licensed alcohol and drug counselor. His hobbies include rock climbing, kayaking, and backpacking. He is a skilled communicator and connects well with others, showing compassion and empathy, especially for those struggling with substance use disorders. So Cameron Green, take it away.
How are you guys? I'm Cameron Breen. Thank you for the introduction, Jen. So I'm Overdose Response Tech 2 or ORT2 over the radio. I'm a person with lived experience. So Jen was talking about that before, and what does lived experience mean? It means, just like she said, I'm a person in recovery. I have over 3 years. Substance-free, sober, clean, whatever you'd like to call it, from alcohol and drugs. I was an IV user in the city of Waterbury for multiple years. Just like Jen said, I am trained through CCAR as a recovery coach. And CCAR stands for the Connecticut Communities for Addiction Recovery. So as a trained recovery coach, I learned how to come alongside a person and meet them right where they're at, use all sorts of different tools to connect with others, some including motivational interviewing and using SMART goals to help elicit change, and different people at different stages going through different things, trying to decide, what they want to do, and if they want to get sober and they want to stay clean. Just a little bit of background, like what it's like in my job is that I respond when I come into work in the morning. I put myself on the board, meaning I use this little police radio right here, and I call myself on the board so that dispatch knows that I am available to respond to any overdose that occurs in the city during the day. From there, I call individuals, OD survivors that I've previously met, either face-to-face at the hospital or at the actual scene of the overdose, and we follow up, just like Jen said, at 24, 48 hours, 72 hours, 14 days, and 30 days, so that I can attempt to, follow a person and try to see, maybe they're not ready the day of the overdose, maybe they're not ready the next day, but, maybe over those 30 days, they will come to a point where they're ready, and I will be there to help them get into treatment. I also can follow up based on police reports that, are completely confidential, but I can follow up with individuals after an OD that occurred on a shift that I was not working. And when I respond, I either respond to the hospital or I meet them face to face, and I just try to show them that, there is hope, that shine a little bit of hope into, what could be the darkest moment or one of the darkest moments of an individual's life. And show them that recovery is possible, and if they take nothing away from it, I hope that they can simply take away that I'm living proof that it's possible, so maybe it's possible for them too. Just like Rushni said, we have a lot of resources that we can give a lot of different people, depending on where they're at and what pathway of recovery that they choose. Really what we're there to do is help them connect to treatment or harm reduction. I'm not a first responder in any form. I just show up to an overdose and try to get the individual connected with treatment or harm reduction. Harm reduction can seem a little odd for some people, and the way what I'd correlate it to is something like a seatbelt, or a mask during COVID-19. You're trying to make sure that there's less death and less harm to the community around you. And so that's what we're there to do. She showed everything except for the fentanyl testing strips, which are right here, just a little dipstick so that they can tell whether or not there is fentanyl in their heroin, and most of it is fentanyl, and fentanyl causes a lot of opioid related deaths, just like Jen said with her PowerPoint. It's a lot of different substances combined. So I have contacts in different treatment centers, around the area, and I attempt to get people connected to care in any way that I can. Addiction is completely treatable, but we can't treat it if the person passes away. So that's what we're here to do. One struggle that I've dealt with is just an individual who was very young, who reminded myself at their age, who I had seen for multiple overdoses, and I showed up to an overdose that, they subsequently passed away from. And to see somebody so young, especially that reminded me of myself, it really, really hit home. And a positive, just like Jen said, this is called the Warm Handoff to Care program. So, we are actually able to physically transport people to treatment using our little brown bomber van from the Public Health Department. And there are multiple people that I have picked up at their home addresses or wherever they, send me and taken them in the morning to go to different treatment centers, Rushford or West Main Behavioral Health, which is actually Waterbury Hospital Outpatient Addiction Services. So that's been, something that I'm very grateful for, to actually see somebody get into treatment and start to stabilize and, gain a little bit of health and happiness back in their life. And just one thing that I'd like people to take away from all of this is that, people deserve as many chances at recovery as they can get. There's always an opportunity to recover. And if somebody had given up on me when I was struggling, that, I might not be able to be here to try to help the next person, and that, ripple effects outwards. And so, if you know someone who's struggling, please reach out. Don't give up, because recovery is possible, and come talk to us because we're here to help. Thank you.
Thank you so much, Kim. And poor Kim and Rush have had a super long day, so we're gonna do our best. And I know Ramona too. You've been going since early this morning. We're gonna do our best to wrap up. We have 2 more speakers. I see that Sam joined us. It looks like he's going for a walk. We have about 10 minutes left. And someone's computer shuts off automatically at 7:37. Who is that? Oh, okay. Whew. All right. So, I hope that's, So we have 10 minutes. That's it, Mary Beth? Okay. Whew, we have 10 minutes. All right. So I don't want anybody to get knocked off of this Zoom. So Lieutenant Stokes, can I ask you to introduce yourself briefly and tell them what it is that you do? And then Sam, I'm going to have you introduce yourself briefly, tell them what it is that you do. And then we want to make sure we give people their 10 things. And I'm going to cut you off. And it's not because I don't love you. It's because I want us to get through this. Ready? Go, Lieutenant Stokes.
Hi, my name is Lieutenant Stokes. I'm the Overdose Response Technician Coordinator with the Waterbury Police Department. Basically, just real quick, I was born and raised in Waterbury, so I have a vested interest in making this program work. I just want to thank the mayor and Chief Spagnola for putting this together and allowing me the opportunity to do this kind of work. I have a passion for helping people, and I just want to say I'm a small part of this team, that Jennifer, Cam, and Rushdie and everybody else, they do all the heavy lifting. I'm just a real small part. They deserve all the credit. I'm very humbled, and I'm a caring person, and the work we're doing is very gratifying. It's probably the most, if I could say, it's probably the best thing I ever did in my law enforcement career, besides delivering a baby. We're helping people every day, and I'm really humbled by this position. And basically my job as the coordinator, I was in charge of training them. I'm a wealth of knowledge. If you read my bio, I've been involved in everything. And I got a passion, for reducing the suicide rate. And they say 20 to 30% of overdoses are actually probably suicide attempts. So we're making a difference out here, and I'm humbled. I'm just happy and grateful to be part of this team. Thank you.
It's gonna make me cry. Thank you so much, Lieutenant Stokes. We appreciate you so much. And he's a huge piece of this, and we can't do this job without him. Last but not least, Sam, would you please introduce yourself and tell us a little bit about what it is that you do in supporting our opioid outreach workers and our overdose data to action grant. Make sure you unmute yourself. Okay, Sam? Maybe. Sam, you're muted if you can hear us. We don't want to kick you off of this. Unmute yourself.
Can you hear me now?
Yes, we got you.
Okay. I'm sorry. I was driving, so I had to hurry. I'm trying to pull over. I'm like, oh no. All right. So Sam Bowens, Waterbury Health Department. For those of you who know me a little bit, I've been with the Waterbury Health Department now for going on 12 years now. I am the HIV STI Prevention Program Coordinator. My history with the Waterbury Health Department started off as a empowerment facilitator, which later led to a temporary position as the program coordinator. I have overseen a lot of EBBIs and DEBBIs, which are effective and diffusional effective behavioral interventions like SISTAs, healthy relationships, voices, empowerment, drug treatment. As far as the HIV prevention program is concerned, I've been there for, like I said, 12 years. I'm overseeing the outreach testing linkage program right now, which I have 2 staff who are counselors and educators. We go out to the community and educate. We test. We refer people to treatment as well. As far as HIV and STDs are concerned, we do presentations to homeless communities, the CHD, Black churches. We are very well connected with our LGBTQ community. Like I said, we do a lot of education, treatment, and referral. So recently, I joined, let me step back. We were overseeing the harm and risk reduction overdose prevention, got a little small grant there. And then we got the opioid grant where I became supervisor for the OD2A outreach workers, Vinnie and Edwin. And basically what we're doing is we're going out to the community along with our prevention unit. We are educating the community. We are distributing naloxone, fentanyl testing strip kits, and informing people on options, meeting the clients where they're at, and referring them and linking them to any type of services that they feel are necessary and wherever they're at right now with their recovery process. I think that kind of sums it up. You know, we're out and about. I'm happy to be a part of this team. I think we got some really awesome stuff going on in the community, and I just can't wait to see where we go in the next year.
Thank you, Sam. Thank you so much for that very, very abbreviated intro. We appreciate it. So we originally thought we had till 7:45, but we're just informed by the library that their computer's going to shut off at 7:37. So we're going to end early whether we want to or not, and I apologize for that. So I do want to bring us back to our final screen of our PowerPoint slide, because it is about what you can do to be part of the solution. So in front of you should hopefully be the slides, which are the following. Number 1, become educated about substance use disorders and medication-assisted treatment. There's a lot of good information out there, and the more educated you are and the more you do that with others, the more the information spreads. Know how and where to find help and who to ask. So it's addictionservices.com or drugfreect.org. You can find treatment availability, and you can call us anytime. You can call me, Sam, Vinnie, Evan, Rush, Cam, Lieutenant Stokes. We will all help you connect to care. Always carry naloxone and download the Nora app and have it on your phone. Anyone can come across someone who's overdose, but if you don't have Nora, all you can do is dial 911. It's an easy medication that anyone can have and use. Learn about the benefits of harm reduction, so that when people say, harm reduction just enables continued drug use, you can stop them in their tracks and provide a little education, a little knowledge drop, as I like to call it, and say, well, actually, harm reduction is this spectrum of things that help people stay alive. Use strength-based, accurate, and empowering language. I am a licensed marriage and family therapist by trade, and language matters. It is either empowering or disempowering, and the last thing we want is for people who may already feel ashamed or hopeless to feel more ashamed or more hopeless. So be careful about our language. Do not label people. Do not boil people down to the conditions that they may have. Use people first language. Listen without judgment. Unless we have walked in everybody else's shoes, it is never our place to pretend we know what it's like to be in them. At liveloud.org, LOUD stands for Living with Opioid Use Disorder. You can find a lot of really good resources and information. Ask the question, how can I help? CCAR believes that their recovery coaches should be trained to ask people, how can I help you in your recovery today? We don't have to be recovery coaches to ask, how can I help? And then to shut up and listen. Challenge stigma when you see or hear it. NAMI CT, the National Alliance on Mental Illness, has an incredible amount of information to help connect people to care and to address stigma and put it in its appropriate place, which is not in our lane of recovery. Volunteer, UnitedWay.org, United Way of Greater Waterbury.org funds a lot of our treatment providers, intervention programs, harm reduction programs. They are a tremendous supporter, and Joanne Reynolds-Galana was on this call earlier. I don't know if she's still on, but we love United Way. And last but not least, never give up hope. People recover every day, and if you're not sure of that, go to any 12-step recovery support meeting and you will see a room full of people who are working on their recovery today. There is hope everywhere if you just learn where to look for it. So with that said, I want to see if we have, no minutes left for questions. It's 7:37, but hope is that beautiful place between the way things were and the way things are yet to be. This information will be shared with you after tonight. I want to say thank you so much for being here this evening. I think we are out of time. I don't want us to get cut off, but again, I want to thank the Satis Bronson Library and everybody else who was on this call. I think I am complete. Mary Beth, is there anything else you need?
Thank you. We're gonna lose signal any moment, so you guys were amazing. Keep doing what you're doing, and thank you for coming out and letting us do it.
Thank you. Until we lose signal, I'll just share. Well, guys, look at the messages in the chat box. They're wonderful and awesome and fantastic, and we appreciate you all as well. So keep up the good work.
We're going to send out a follow-up email to all the recipients with the bibliography of resources we have at the library too, and whatever you want to include as well.
Great. Wonderful. All right. Thank you, everyone. Have safe travels home tonight. Be part of the solution. You already are because you were here.